Tēnā koutou katoa. Welcome to eHealthTALK NZ. I'm Rebecca Macbeth. I'm the media editor at HiNZ, and today I'm joined by Alex Kemp, who's the CEO of HiNZ, and also by Stella Ward, who's the CEO of the Digital Health Association. So welcome on the show to both of you. Can you just start by telling our listeners a little about yourself and the organisation that you lead?
Thanks, Rebecca. Kia ora koutou. I'm Alex Kemp. I'm the CEO of Health Informatics New Zealand. Health Informatics New Zealand is the trusted community for digital health. So we aim to connect the health workforce, clinical and non-clinical, with the innovation and industry sectors and education and research sectors to connect so that we can have real change in digital health. Myself, as a background, I'm a speech and language therapist originally. Ended up in health leadership. It was a focus in particular on disability and children's health, and came to HiNZ approximately 2 years ago as Director of Engagement, starting here as CEO in December last year.
Kia ora, everybody. Stella Ward. I am the Chief Executive of the Digital Health Association, which is the industry voice for digital health solutions and services across health and social care. And we have members that range from individuals and startups right through to SMEs, large multinationals, including those exporting from New Zealand, but also those that are based elsewhere and have a New Zealand footprint. I too am a speech language therapist, and so have worked with Alex in the profession as a colleague, but also I've had a stint in executive leadership roles, CDO. I've also worked in the sector in a multinational and also in an exporting software company. And so it's great to be the chief executive of DHA, which I started in August. So Alex and I are new together, which also has created this fantastic partnership. So the Memorandum of Understanding was signed with HiNZ and DHA at the Digital Health Week in November. And both of us as newbies are looking to have this conference this year as part of Digital Health Week with a new look and feel and a new way of engaging.
You have described this conference as having that new look and feel, as you just said, but what does that mean? What's changing compared to previous years?
I think probably the most significant change is that industry have a same connection as the clinical workforce and the health service provider landscape. So we're all together as part of the ecosystem and the community. And that, I think, will create a different feel in terms of, yes, there's going to be industry exhibition booths. Yes, there's going to be sponsorship that comes through from industry, but also from other parts of the sector that Alex talked about in terms of academic and research and also possibly providers as well. So I think that changes the landscape in terms of how we're doing it. We've also got a different way that we're wanting to present the program, which I'll get Alex to speak about in more detail. And it's the first time we're doing it really, really in partnership, and so it should feel different because it's really connected.
Oh, well put, Stella. It's great to have DHA working with us and to really see the industry voice coming through in partnership this year, which I think will make a real difference. Physically, the conference is going to look different. So we're going to have a more integrated feel. And both Stella and I have been really clear on the vision that this has to be a conference which is about action and about real change. And so we're bringing everyone together as equal value parts of the community to talk and really have those discussions that lead to meaningful change, moving away from talking about change, which is often how conferences can be. And I think it's going to be a really exciting, practical, integrated, driven, connection-focused event where hopefully people will come out of it really moving towards action rather than inspired to think about action.
So as you said, it is the first time HiNZ and DHA have co-led the event. So what does this partnership enable that hasn't been possible before?
We're getting the voices of all the communities coming forward. Stella has been able to contribute both from her longevity in the sector, which has been fantastic, but also really ensuring that industry have an equal voice in how everything is shaped. So we are able to really have better knowledge on what industry needs. So you'll see our sponsorship options look a lot different to previous years. that the way that our stages are formed look really different to previous years. And we've really focused on how we can bring everybody together to have those conversations. So the exhibition hall and the speaking areas will be combined for the first time this year. And we'll have lots of opportunity for people to have meaningful discussions away from a single exhibition space and single speaking rooms, which I think will create some interesting and really valuable discussions for everybody.
I would support that, and probably the thing I love about it is design, or a human-centered design practice suggests that if you can create moments where people with different perspectives can collide and connect, then innovation and an opportunity for action, which is what Alex spoke about as our focus, can occur. So there's plenty of opportunity from the traditional space. Yep, you can go to the exhibition booths, and yes, sponsors are going to be on stage, and yes, there's going to be plenary speakers and all of the things that you would expect from a conference. But the look and feel that Alex described means that there's going to be more meeting spaces, more connection opportunities, more spaces you can go and book and have a conversation with that person that you meet in the coffee cart queue to then say, oh, let's talk a little bit more about that. And hopefully that will help bring and build that momentum for action and change and innovation, hopefully, too.
You've both talked about designing the conference around the entire ecosystem. So if you can just talk about who are some of the key groups you're trying to bring into the room who perhaps haven't been in there before or might not necessarily see themselves as digital people, but know that they need to engage and move forward in terms of adopting technologies. And why does it matter particularly now that we do that?
Well, I would argue, and I know Alex will be able to speak to some of the communities that we're targeting, but I would argue that there's no such thing as health without digital. And so even if you think that you haven't got anything to contribute to a conversation, you do. So if you're non-clinical, clinical, a leader, funder, a student, a teacher, you're an industry member, an engineer, you've got something to contribute to this community, and you've got something that you can learn as well. And together, that's how we are going to be able to create the kinds of tools and processes and opportunities for digital to be that enabler of improving access and outcomes for the health of our population here in Aotearoa.
The World Health Organization says that by 2030, everybody in health, disability, and the wider social sector will be using digital tools. So we're talking about people who are already probably using some of these tools and don't realizing it, and are definitely using these tools in everyday life, are going to be required to use these tools to enable better outcomes for the community. So anybody who has an interest in making better health outcomes happen for the community and for whānau should be at this conference. We also know how important it is for our innovators in our industry to be connecting with frontline health workforce and with the community in order to develop the right tools that actually will lead to meaningful change. Around 3/4 of tools that are developed without that input aren't going to work well. So this is for everybody to come together, from those who are developing the tools, from those who are going to be using the tools, those in research who are evaluating the tools and working out what else is going to happen and trialling conceptual tools, and those who are training the next generation of the health workforce in clinical schools to come together, learn, share their knowledge about what's working and what's not, what are the gaps in the health system, and share great ideas that could be turned into wonderful innovations for the future. It's a great opportunity to have those conversations.
Definitely. And I think what makes it unique, a lot of industry and other people who go to conferences all over the world do say that that trusted environment where it's not us, them, everyone's in it together working towards the same goal, which is ultimately better healthcare, better patient outcomes, and seeing each other's strengths and being willing to talk and learn from them is something which has always been really special about Digital Health Week, and I know will continue. And I know you've also done a lot of work, both of you, around really engaging with other sector organisations, other not-for-profits, those that represent our health workforce, to say, digital is quite a specialised subject in some ways, but let's engage. We can support each other to really bring your workforce forward and educate them as well. Could you just talk to that a little bit in terms of those other engagements?
We've been both forming very strong relationships across the sector, across other health associations, professional associations, sector associations, to work with them to say, where can we, by coming together, create great change? And those relationships are really fundamental going forward, both in bringing the knowledge from those sectors through, and also by sharing what we know and connecting with those that we know are experts in digital health. It's a really connected network, ecosystem, community, whichever word you want to use, that really is effectively and efficiently making sure that we're united where we need to be, where we stand individually where we need to be, but so that we're sharing that knowledge really effectively across the system.
Good point, Alex. I would add, I think it's the fact that we're two speech language therapists who come from a profession that thinks about human connection and communication and how important it is to get people to come together and try and understand each other and find a common language in order to be able to grow. And so what has traditionally been, there's a rural sector and there's the aged care sector and there's the primary sector and there's the hospital and then there's the not-for-profits and all of these kind of pillars of the ecosystem. And there's nothing wrong with that. There are important opportunities to deep dive into what that means for each of those. And then, as Alex described, there's the professional networks and the industry networks. But this creates the opportunity for the connection of all parties to come together and find that common language and find that opportunity to connect and work together and collaborate for action and change.
Trust is one of the most underrated factors in change, and it's such a critical factor in change. And if you just take that moment to hear somebody's story, to understand their why for being in the room, it can make all the difference to building those relationships that we know. We all talk about change needing to be sustained past political changes, past changes within areas. We know that if you can build that trust, that relationship can sustain, and that is what's really going to lead to meaningful change.
Yeah, just going on from that, we do know the digital health sector is dealing with, it's got workforce pressures, it's got funding constraints, there's hugely growing digital expectations. And you've said, you want this to result in change. But how do you avoid the conference becoming talk heavy with little real action afterwards?
Call it wet dog syndrome, because people go to an event and they come back going, it's amazing. And then the wet dries off and they end up with the same situation happening. And I know Stella will be able to talk well to this because it's something that she's historically shown in her career as being a critical part of sustainable change. From the design of the conference point of view, everything from the way that we ask people to submit abstracts is going to be really focused on where real change has occurred. How can you show the difference that change has made to the community? Where did change go wrong and how can we stop that from happening again? Right through to making sure that our conversations that we're having in those days lead to further conversations after the event. This is not just about the event itself, it's about the sustained communities of practice that both DHA and HiNZ have going on and carrying on those conversations in meaningful ways after the conference.
I think the thing about change or a talk fest is when people feel disempowered. And actually, all of us have the ability to make a small difference. And every little small difference, as long as it's all going in the same direction, can have a massive impact for the people that we are serving, whether that's a small community or a large community, depending on where you sit in the ecosystem. And so I think the fact that we will have leaders and decision makers and inspiring speakers from around the world part of our program, and we will have people who are doing it in their community or in their service or in their team sharing their stories, then you can see the breadth of opportunity for there being about action and momentum. And that gives decision makers confidence that actually there's this huge capability. And sure, if you only focus on all the problems, then you just come up with a very good polished problem. But if you demonstrate there's actually a whole lot of solutions that are already in play and that someone could hitch their wagon to a solution that's already in play, then the momentum can build. And I think that's what's exciting.
Also got some really cool new ideas planned for speaking sessions during the conference. So we'll look out for things like Dragon's Den type situations, working through problems live on stage from different parts of the sector, some really great ways of showing that change in action by bringing people together and promoting that cross-sector attendance on stage so you can see live how things are going. So watch out for those great program changes that will come through.
Something I've always loved about the community and the conferences is that mixture of people who are in digital health. They care, they want to make things better, and they've also got that optimism of the belief in technology as one of the enablers of that, and that change can happen and that things will improve. I always think that creates an amazing buzz at these events. Stella, you did talk about industry as a core part of healthcare delivery, and that it's about ensuring industry voices and expertise are meaningfully included. Can you just expand on that a little bit? What do you mean by that?
Well, with the support of Alex and the HiNZ team and how we'll work together for this first time, is that industry will have greater opportunities to contribute to speaking slots, and industry will also have greater opportunities to attend sessions. And so the thing about being the industry body is that people think that there isn't any people who have clinical background, but many of our industry members have got clinicians on their team who are supporting the deployment, development, and change processes as these tools are rolled out across various parts of the sector. So that's probably the most meaningful. Industry still are involved in supporting exhibition booths and sponsorship because that's a core part of how industry also like to show up. But what we've done is expanded the way that industry can show up by creating opportunities for them to contribute to the program, lead in MC stages, and also be on panels and attend sessions as anyone else can.
Alex, the redesign, I know we did some feedback after the last conference and you talked to a lot of people about how we can improve things. We're always looking to do that. So what have been some of the most consistent messages you've heard from attendees and sponsors at past conferences that you're putting into action now?
One of the strongest themes that has come through is the reason why people attend conferences. They always want to attend to hear great innovation and great speakers, but they also attend because they want to connect with people. And I don't know if any of you have ever done what I've done and attended a conference and actually barely gone in the room because you're connecting with so many people outside the room. So we're creating intentional space for people to be able to connect at this event. We also know that people want a chance to be able to connect with their kinfolk, with people like them. And for some people, that may be people who they don't know about yet because they're just starting in an area or because geographically they're so separated. So who else is having challenges moving from a great idea into actually trialing something? Who else is having challenges with getting a wonderful tool actually accepted by their managers within their practice? What are they doing wrong? So we're going to give those opportunities for people to speak. We also know that as much as we rely on industry to enable this event, without them, it would not be practically affordable for people to be able to register to go. It is really through their sponsorship that what is right for one part of industry is not necessarily right for another. So we're really, thanks to the great work of Stella and her team, enabling a wide range of options for different parts of the industry and innovation ecosystem to be able to contribute. The third really important lesson that we know is that people don't respond well to what they feel is sales pitches. So it's always been kaupapa of HiNZ that they focus on the meaningful change that their contribution, their product or their technology has made to the ecosystem. But they do that in a way that really connects, as Stella said, using those translation skills. So we've got some great guidelines and some great parameters for those contributing their knowledge about a particular topic to be able to make sure that it's meaningful and translates in a way that other communities there will be able to understand.
Great. Thanks, Alex. Can you just tell us a little bit more about the details, the venue, the pricing, and, the improved accessibility that you're looking to offer this year for the people to attend?
So this year we are holding the Digital Health Week conference at Dewdrop Event Centre in Manukau. And if you've ever been to this event centre, as soon as you walk in, it feels like community. It's in Manukau, so great accessibility from the airport for those who are travelling. And when you walk into it, it has this great space around the outside where people can connect and where people can talk to each other. And then it has two inner areas that are beautifully connected where we're going to hold the exhibition and our speaking stages together. So it's all combined in one community feel. Dewdrop Event Centre is a social good initiative as well. So they contribute back into expanding arts and culture in their community. And the way that they work within their community really felt aligned with our purpose of connecting DHA and HiNZ and connecting the whole of our digital health community, digital health ecosystem together during this 2-day event. We've been able to agree that pricing is important for everybody this year. So we've made a commitment to make the registration price materially lower than last year and have a wider range of options for those who want to contribute to sponsorship this year. So we're looking forward to being able to provide those to you. Great opportunity to sponsor other people attending too. So that's something I really want to promote, is you'll have the ability to contribute towards someone such as a student or in an NGO or in a particular sector to be able to attend the conference who may not otherwise be able to afford it.
Excellent. And so, looking ahead to November, Stella, what would success look like for you, for the DHA, and for the partnership as the conference wraps up?
Great question. What does success look like? Well, first of all, that we have a fantastic event, that we've got good sponsorship engagement, good industry engagement, good ticket sales, and a program that inspires people. That's kind of the baseline success. Then in terms of what we want to see is those connections happening, the collaboration happening, and the passion, I guess, and the building momentum for people to take away something and go and put it into action and be inspired to do that. And then I guess the other is that we've demonstrated how to work together, and we're looking ahead for what else we can do as partners to support both our members in different ways, but our combined impact and how it contributes to New Zealand's economy and the improved health outcomes for New Zealanders.
I hope that people come up to me and they say, I've learnt something, I've met many people, and I'm changing lots. And in that order of importance. And I agree with Stella. I believe that this is the beginning of a great relationship between HiNZ and DHA, and how we can show together that we are stronger when it comes to partnering with this event. And I hope that we get that feedback, that people say we can really feel the difference that this event made in terms of the partnership, and we can really see the added value it gave us as members of both organisations and as the wider community of the two organisations coming together. I also hope that we're all not too tired by the end of it, and that we get to enjoy a wonderful, great 2 days with people who are aligned in their thinking, and that we do come away with that feeling of inspired, but inspired to act, and inspired to keep going, and inspired to stay connected, so that we start to see some of that connection continuing 3 months, 6 months, a year after the event.
Yeah, though I've always loved the stories when people say, I met my future employer at Digital Health Week, or they met someone else who was doing a project the same as them, but in the North Island, and they didn't know, and the connection helped them so much in terms of that change and not reinventing the wheel, which is obviously not something we want to be doing. I always find those stories inspiring, and you hear them every year, so I'm sure we'll get more 2026. I do have to wrap it up there, though, so thanks for joining me today, Stella and Alex. It's been really interesting and inspiring discussion. So we look forward to seeing how the conference progresses, and we'll be sharing more information on that. To our listeners, be sure to like and subscribe to this podcast to make it easier for others to find. Mā te wā.